Over half of South African beverages will require warning labels for high sugar and artificial sweeteners in order to address a serious diabetes crisis. Now, that's according to researchers from the University of the Witwatersrand's Department of Physiology. The department says that it has analyzed 603 non-alcoholic beverages from major South African supermarkets. Now, the study found that over 20% of all beverages needed a warning label for high sugar content, and nearly 50% for artificial sweeteners, and almost 60% required at least one of the two warning labels. Now, globally, there's been an increase in the availability and consumption of unhealthy food, and this has contributed to bad health outcomes, including a rise in obesity. But for more on the study, we are now joined virtually by lead author at the Department of Physiology at the University of the Witwatersrand, Dr. Simphiwe Dlamini. Dr. Dlamini, thanks for your time. Welcome to Morning Live.
Thank you, Sakina, and thank you for having me on your show.
Perhaps we could start off by just looking at the primary aim of your study and what exactly were you trying to establish?
Okay, so Sakina, as you know, that we are facing a serious health crisis when it comes to obesity-related diseases. So the Department of Health has implemented several interventions in order to address the problem. So one of the interventions that they recently proposed was amending the current regulations when it comes to advertising and labeling of foodstuffs. So in the recommendations or in the proposal that they had proposed to include warning labels as part of the amendments. So because we understand that sugar sweetened beverages, they've contributed significantly in the rise of obesity and non-communicable diseases. So we wanted to look at the proportion of these beverages that will require these warning labels, specifically focusing on sugar, on high sugar content, as well as the presence of artificial sweeteners.
And Dr. Dlamini, just the methodology that you employed in your study to identify the beverages that you sampled and those that ultimately would require warning labels.
So the first thing that we did was to first identify the leading supermarkets in South Africa. So in order to do that, we used the Deloitte reports, the Deloitte financial reports from 2023. And then between May and July 2024, we had to identify the beverages that were sold in these supermarkets. And then what we did is, after identifying the ones that are sold in supermarkets, we specifically focused on juices, soft carbonated drinks, as well as energy drinks. So what we did is, then we went to the brand websites in order to identify the nutritional information, because some brand websites, they do provide the nutritional information for their products. And then we had to, for those that did not provide the nutritional information, we had to do in-store visits where we had to take pictures and extract the list of ingredients as well as the nutritional information. And then what we did is that we used the proposed criteria, the one that's proposed by the Department of Health in terms of identifying products that would require warning labels. And when we identified or determined the proportion of these types of beverages that would require these specific warning labels. And then what we did is we compared the different types of sugar, of sweetened beverages that would require the warning labels. So we compared the three types of drinks.
Dr. Dlamini, do South African consumers generally have a positive attitude towards warning labels on things such as processed foods and drinks? And is there consensus on whether these labels actually do change consumer behavior?
Well, it depends on how you look at it. If you're looking at it at a population level, I'm not aware of studies that have specifically looked at these types of how people will respond at a national level. So there are some studies that have shown that these warning labels would work, focusing on specific populations there. And there are a number of studies that have been done in other countries to show that these warning labels would work, specifically the nutrient-specific warning labels. So that's why the World Health Organization is recommending these warning labels, because they have been shown to be effective for consumers to identify products that are unhealthy.
So, very interestingly, Dr. Dlamini, very often consumers would think that juices, especially those that are said to be 100% fruit juices, are generally perceived as a healthier alternative to a carbonated soft drink. So, what was your observation in this regard, however? Because this is generally one that people tend to talk about.
It's true that most people that's how they would perceive the juices as healthier options compared to the other beverages. But in terms of sugar content, it depends on how you look at it. In terms of sugar content, juices, we found that juices, they had the highest sugar content, and this is something that has been well acknowledged by several entities. Even the Department of Health is aware that juices, at the moment, juices are they have the highest sugar content. So in terms of sugar content, juices would not be the best option. Let's say, for example, you have someone who's diabetic, or someone who's health conscious, or who's watching their calories. So what we showed is that even though juices had the highest sugar content, so if the warning labels were introduced with the criteria that has been proposed, so most of the juices, even though they have the high sugar content, they would not require the warning labels. And it's simply because sugar from juices, it's not added, so it comes from the fruits. Or else with the other beverages, the sugar is added. So the criteria that are used at the moment, they focus on added sugar and the total sugar content. However, when it comes to health, the body doesn't care whether the sugar is coming from the fruits or it's coming from sugar cane and it has been added or not. It has the same effect in terms of its effects on weight gain, as well as controlling your blood glucose levels.
So from the explanation that you just gave us, Dr. Dlamini, would you then suggest that the South African government consider revising the criteria for these warning labels to include beverages with high levels of naturally occurring sugars?
Absolutely. So the best approach in this case would be to revise the warning label such that the products that contain what they call naturally occurring sugars, they have to be considered as well, because the consumers are going to be heavily misled if the warning labels are introduced, because you would find that there will be many products that are shown to be or have the warning labels for high sugar content, and then the consumers are going to assume that because juices do not have these specific warning labels, then they should have low sugar content, which is not the case, which would be extremely misleading. And this is likely to lead to overconsumption of these beverages, specifically juices, specifically 100% juices.
And of course, we've seen these warnings on tobacco products in the main previously. So how effective are these front of pack warning labels? I'm not sure if you've done any sort of research into that, because I would imagine that that could be some indicator for how this is likely to play out as well.
So it would depend. So let's say, so studies that are mostly done in these types of studies, where they are evaluating whether people are going to stop smoking or not, they focus largely on a large population. So let's say in South Africa, there are 58 million people. And then if the study shows that only, say, 10% of that population would actually use the warning labels. But if you think about it, 10% would be quite a large number within a South African context. That would be millions of people who would be assisted in terms of using the warning labels. So, for example, in South Africa, we know that we have a high prevalence of diabetes. So individuals who are diabetic, they are most likely to have to use the warning labels in order to identify products that are high in sugar content and be able to avoid them. So it might not be everyone who's benefiting from the warning labels, but definitely there are people who do benefit from warning labels that have already been introduced.
Well, we have to leave it there. Thank you so much, Dr. Simphiwe Dlamini, who's with the Department of Physiology at the University of the Witwatersrand, speaking to us about the need for beverages to have warning labels for high sugar and artificial sweetener content.